everyone, and welcome to Nurse on the Move. Today I will be talking about differences and similarities in hospitals that you can find coming from wherever you work full time. You'll notice whenever you start traveling or when you go to another hospital, there are a lot of differences and similarities, but nothing to be afraid of, nothing to worry about, because you're just going to knock it out and rock it out anyway. I'll go into the differences first. So the differences that you'll see is that some hospitals require testing before starting, and usually if you fail a test you'll have another time to take it, but I have taken an EKG test, a pharmacology test, and one time I definitely had to take the BCAT as well. But sometimes they're pretty lenient and they'll help you out. Agencies usually do a good job at letting you know what to expect for your first assignment. Another difference that I've seen in the hospital is the medication dispensing systems as well as the charting systems. So Pyxis is a big one. I can't even think of the other ones that I've worked with, but there are definitely some different medication dispensing systems other than Pyxis that I've had to use. It's very easy to learn and to catch on to, as well as the charting systems. Most of the audience, we're millennials, so we're already familiar with computer and just being on the screen typing and things like that. So it's not too hard to figure out how to use these different computer systems. Cerner, Epic, Meditech, Allscripts, McKesson, those are some big ones that I've seen. I can't even say I've seen one computer system more than I've seen another computer system. Another difference that you'll see is when collecting specimens. There are some hospitals that they actually have the label printer. You print out the labels, and there are other hospitals where you have to get the label from the chart and then you put your initial date and time. So for Epic, when I used Epic, they have the automatic printers and it already has your initials, date and time, and you don't have to physically write it down. Even like when you collect specimens, so the lab knows that you collected, there's different methods in showing that you collected the specimen, so that can vary as well. Hospital policies, that's a biggie that changes hospital to hospital, and standing orders. There are certain orders that you don't necessarily need a doctor, because the hospital policy is that if XYZ, then you can put the order in under per policy. That would be the reason under the admitting doctor. When it comes to putting in IVs, how long IVs are supposed to stay in, how long tubing, secondary, primary tubing is supposed to be hanging, that varies from hospital to hospital as well. So those are just some differences that you'll see when traveling to different hospitals. Okay, so now we're going to transition to the similarities. What is the same no matter where you go? No matter where I go, I have to get trained on the glucometer so that they know that you know what you already know what to do, I guess. And there's a written portion of the glucometer test. Knowing how to use the controls and how to test the glucometer, no matter where I go, that's one thing I have to do. Also, what I had to originally ask a question of is it going to be the same? Am I going to be doing the same work? Yes. Patient care is the same. Nursing is nursing. No matter where you go, being a nurse requires the same set of skills. You might have to do a little bit less or a little bit more. And if it's something that you have never done before, it's just ask the question. So I had to, at this hospital that I currently am at, they did not want the nurses to do any PICC line dressing changes, or we could not pull out any PICC lines. I'm very competent in cleaning a PICC dressing, and I'm very confident in taking out a PICC line, but hey, that's fine. The charge nurse can do it if that's less stuff for me to do. So contacting the doctor. You have to contact the doctor no matter what for certain situations. that pretty much stays the same. Emergent situations, of course, that's kind of like the last thing you want to do is to call the doctor, but no matter where you are, you'll have to call the doctor. Of course, for orders, you'll have to call the doctor if their blood sugar is above whatever, probably like 400. You have to call the doctor. And if you want to change anything or have any recommendations for care, anything that needs to be included or discontinued. So when it comes to Foley catheters and PICC lines, then is it necessary? No matter where you are, you have to make sure the Foley catheter is in for a reason. It has to be a real reason. Not because they're incontinent. That's not a reason to have a Foley catheter in. You have to have the reasons, and if they are deemed appropriate for that, and do they meet the criteria for discontinuation of the Foley catheter or PICC line, because we want to decrease the infection. We don't need any nosocomial infection, so across the board you will have to assess your patients for the need of PICC lines or Foley catheters. So being in the step-down unit, working in telemetry, my 4-to-1 ratio pretty much stays the same no matter where I am. Pretty much. I have not had any more than 4 patients being on the step-down unit. It might even have 3 sometimes, depending on the census. Well, friends, I really hope that was helpful for you. In case you had any questions about what to expect, differences, similarities, what to expect going into a travel assignment, or even if you are currently working and you're like, am I the only person experiencing this, or is this normal? And if you have any suggestions of videos that you want to see, just hit me up, let me know. But have a happy week, have a great week, and Happy New Year to you. Bye.